This research seeks to evaluate whether nursing-guided cognitive behavioral therapy can be available an effective alternative to traditional treatments, thus optimizing mental health records. Anxiety disorders are one of the most prevalent mental health conditions worldwide, profoundly affecting the quality of life of those who suffer from them. Anxiety symptoms not only impact patients' emotional well-being, but also interfere with their ability to perform daily activities, maintain personal relationships, and fulfill their work responsibilities. The integration of behavioral and nursing-led cognitive therapy represents an innovation in the field of mental health. Nurses, because of their context and close role in the patient's care, are in a privileged position to implement therapeutic intervention in a clinical or community setting.
The general objective in this study is to evaluate the effectiveness of nurse-guided CBT in reducing anxiety symptoms in patients diagnosed with anxiety disorders. This central objective focuses on determining whether the intervention of nurses in the application of CBT has a significant impact on reducing anxiety. The specific objectives are three. The first is identify the specific CBT strategies used by nursing staff. This objective focus on identify and describing the components and techniques of CBT that nurses can employ in their intervention with patients. The second is evaluate anxiety symptoms in patients before and after the interventions. Through evaluation before and after the nursing guided CBT intervention, the aim is to analyze change in anxiety symptoms in patients. The third is compare the effectiveness of nurse guided CBT with other not pharmacological interventions. The objective seeks to establish a comparison between nurse administered CBT and other not pharmacological therapeutic intervention, such as relation therapy or psychological counseling in terms of reducing of anxiety symptoms.
CBT is a therapy intervention based on the iron-based cognitive theory, which holds the emotional disorders such as anxiety and the product of distorted through patterns and behaviors that reinforce this truth. In the case of anxiety, irrational through can lead to catastrophic interpretations and an overstanding of danger, which maintains the cycle of anxiety. CBT objective to identify and modify this irrational belief through techniques such as cognitive restoring and controlling exposed to any stimuli. Within the context of nursing, the implementation of CBT represents an opportunity to expand the role of health personnel in the management of anxiety disorders. Nurses, thanks to their constant interaction with the patients, have the ability to identify anxiety traits and implement interpretations to help patients modify their dysfunctional thought and behavior. This allows to the comprehensive and continued approach, which addresses both the physical and emotional part of the patient, promoting sustained recovery and less use of pharmacological treatments. Nursing by applying CBT also strengthens the relationship of truth with the patient, facilitating the therapy process.
The study will combine qualitative and quantitative methods to evaluate the effect of nurse-guided CBT in patients with action and the Clinic University of Savannah, using a descriptive and recollection. They see change in action symptoms will be analyzed in an for example, 100 patients divided between two ways in the intervention and to note to compare the result. Same structure, interviews and surveys will be used to measure anxiety before and after the intervention. Quantitative data will be analyzed with using the descriptive analysis and recollection, while qualitative data will be coded and evaluated thematically to identify patterns in patient and experience.
Quantitative data will be collected through the GAD-7 questionnaire and other quality of life instruments, allowing the impact of nursing guide CBT to measure it reduce anxiety symptoms. Through descriptive and correlational analysis, the relationships between pre and post intervention anxiety levels, as well as the quality of life reported by patients, will be explored. Qualitative analysis, the same structure interviews will be recorded, transcribed, and subject to an inductive coding process in which emerging themes will be identified. These topics may include aspects such as reducing stress, strengthening coping and skills, and the perception of the relationships with the nursing staff. This analysis will provide a better understanding of how patients experience nurse guide CBT and what factors contribute to its effectiveness from the patient's own perspective.
Okay, the nursing guide in hereditary disorders is an effective and ethically sound approach, providing nursing and properly trained and practice within their professional scope. From a medical perspective, ensuring competency, informed consent, and cultural sensitive is an essential to delivering effective care. About ethical guidelines around confidentiality are paramount in mental health treatment. Nurses must adhere to the same confidentiality standards as other mental health professionals to protect the patient's privacy, insurance, and safe therapeutic environment. And we have secure data storage, legal compliance, and finally, we have an ethical standards.